This patient is 50 years old, complaining of chronic cough since young age and shortness of breath for long duration. Therefore, he is a respiratory problem, cough and expectoration. Today we try to examine the respiratory system of 5 parts: inspection, palpation, percussion, auscultation, inspection. For 4 parts: inspection, palpation, percussion, and auscultation. Inspection composed of 5 parts. Now, first of all, shape of the chest. Gumi Asad. Tell me what's the shape of the chest of this patient. Slightly barrel. Whether is intercostal recession,
muscle.
indicating a chronic obstructive airway disease. Inside, indrawing of the intercostal muscle during inspiration. Therefore, slightly barrel chest. He is not a smoker. He is a chronic bronchitic, chronic bronchiectasis. This patient got. Therefore, the shape of this chest is slightly barrel chest. This is first. Number 2, the respiration. We mean by respiration rate, a type of respiration.
التعب هو
abdominal thoracic اللي هو typical بصير بالميل. نعم.
أي الرأيت لازم نحسب.
يلا حسبين. حسبين. The rate of respiration. Normally rate not more than 20, and between 20 to 25 it is a borderline, right? 25 and more called tachypnea.
Below 50 it's bradycardia.
around more than 6.
مو ده جد؟
20.
تحسبي مرة ثانية هذا. He is short of breath. He is, while he is lying short of breath. Make sound. لازم يطلع هذا أكثر من 25. Yes. Therefore, it is a 25. Therefore, this patient got what? Tachypnea. Slight tachypnea. Tachypnea, we have types of tachypnea. Shallow tachypnea, just like this. Shallow tachypnea, call it. This is due to acute insult on the respiratory system.
Like exercise.
Pneumonia, exercise, anxious,
fever,
nervousness, fever, pneumothorax, fractured rib, all of these causing what? Shallow tachypnea. More than 25 per minute. And there is another tachypnea, is a deep tachypnea, just like this. What we call it air hunger. Usually this occurs in diabetic ketoacidosis, in metabolic acidosis, in aspirin poisoning. Okay? This is tachypnea. This is, this patient got what? Shallow tachypnea, indicating there is a respiratory problem. Okay, therefore shape of the chest, and we have many shape of the chest. We have the normal, we have the barrel, we have the pigeon chest, we have the Harrison sulcus, we have the funnel chest, and we have the kyphosis, and we have scoliosis, and we have kyphoscoliosis, 8 types, and flat chest, مضغوط. This patient got slightly barrel chest due to chronic obstructive airway disease. I mean by this, asthma, chronic bronchitis, chronic obstructive airway disease due to smoking, and even bronchiectasis. Trapping of air inside and make it slightly barrel. The third part of the inspection of the respiratory system is the type of breath. قلت الريت مالته type breath قلت شنو؟ Therefore shape and respiration all. 3 cardiovascular all. By cardiovascular all in by inspection هي الابيك سبيد. باع الابيك سبيد هنا. لا تقيسي.
احنا مجرد الانسبكشن.
اقطع النفس عليه. اقطع النفس.
حياته بينه.
هلا وسهلا. هلا بيك. ها؟ We look for the epic speed. We look for the suprasternal pulsation. We look for epigastric pulsation, and we look for the carotid pulsation and JVP. Carotid pulsation هنا and JVP. All these part of inspection of the respiratory system. Therefore, the shape of the chest, to the respiration all, cardiology all. Epic speed visible, invisible. Where after you said invisible, you should look down, probably here, not seen. We look here, not seen. We look here, not seen. Therefore, it is not seen because of the hyperinflated chest, because of the barrel chest. Epic speed is not visible. Epigastric pulsation, we ask the patient to stop breathing. وقف النفس مالتك. وقف النفس. There is but slight. نفس. Suprasternal pulsation. وقف النفس. Not seen. Carotid pulsation. اقطع النفس عادي. Not seen. Epigastric pulsation, hyperdynamic circulation, tricuspid valve disease. We mean by hyperdynamic circulation, exercise, fever, anxious patient, etc. Therefore, shape of the chest, respiration, cardiovascular. The fourth part of the inspection is the movement of the chest. علي باوع هنا باوع هنا باوع هنا فك حلقك وخذ نفس وخذ نفس movement خذ نفس قوي. Movement of the chest. هذا التايب او respiration خذناه بالبداية. Movement حركة ترس هواء خلي هواء. اكو slightly limitation بالmovement of the chest. mainly موجود وين بالرايت سايد. Because he have surgery on the right side, he have lobectomy on the right side, and because he have a generalized disease, therefore we get generalized limitation of movement by inspection. We mean by movement this way, okay? This is تصورني انت. This is the movement. This is a normal, okay? This is abnormality on the right side, mean disease on the right side because the lung is not distended. This the other way. Therefore, this is the left lung is not distended. Therefore, the disease what on the left side. After you decide the side which is not moved, you look for whether it is in the upper or in the lower part of the respiratory system, in the chest. Mostly 90% of the disease is in the lower. In pleural effusion in the lower, pneumothorax بالlower, CA usually بالlower, mainly in lower. Okay? Therefore, this is shape of the chest, respiration, cardiology, and movement. The fifth part of the inspection is extrathoracic. We look for what? We look for a clubbing,
Cyanosis.
and he has a clubbing.
Cyanosis.
And we look for cyanosis. He got cyanosis and hot. Therefore, it's a central cyanosis. And we look for edema. edema اكو عنده edema بالleg. No edema in the leg. ماكو edema. inspection ماكو edema. inspection لا تقيس. زين. and we look for the JVP. طلع لسانك. Yes, it is central cyanosis. And we look for the JVP. JVP is not visible. Okay, we finished inspection of the respiratory system. We come now for palpation of the respiratory system. It's also 5. Epic speed. سوي لي palpation epic speed.
دكتور لازم نخلي الهاند على under the nipple.
No. You including the nipple with your hand. That's way. Okay? This is the hand. Including the nipple. Have you palpated something? انت قلتي not palpable here تروحين لجو. You go down. Probably the apex beat in the axilla. Not. You go on the right side on the I mean the border of the left side of the chest. No. You go to the right. Go to the right. It's not palpable. This is the apex beat palpation. The second palpation is the trachea. Trachea palpation. By single finger. خذي هذا الاندكس. الاندكس. تعال شوف تعال منا صور. تعال منا صور. The patient is there and we push the hand in the suprasternal and we move it to see the ring of the trachea ring. To feel the ring. بين الring and we push it down. Is not being pushed because the trachea in front is. Therefore, trachea is what? Central. Okay? Slightly to the right. Okay? First of all, you put your hand on the sternum, index finger. We push the index finger to feel the rings. If you couldn't feel the rings and you feel flesh, I mean tissue, therefore this is the thyroid, retrosternal thyroid. Therefore after that percussion of the chest is a must.
For diffuse.
But in this patient the trachea is there. This is the cartilage. And then we push the finger this way. It doesn't go further than the trachea. Therefore trachea is central. And then palpation of the apex beat, palpation of the trachea. Palpation, the third palpation اللي هو expansion.
Chest expansion.
Chest expansion. على النبل. جيبي فولد جيبي بعد هسه. لا طبقيهن. هسه علي خذ نفس قوي. حلو. Yeah, expansion nearly 1 to 2 centimeter. It is limited expansion of the chest. This is the way of measuring the expansion of the chest. And then 5 points in palpation, apex beat, trachea, and then the expansion وبعد كده
التراكية
apex beat, trachea, expansion, then the vocal fremitus. vocal fremitus خلي ديش. قولي له 1 2
1 2 3 1 2 3
ولا تنسي روح اللي جوا.
1 2 3
equal. This is and then therefore apex beat, trachea,
Chest expansion.
expansion, vocal fremitus, and the fifth is surgical emphysema. because he have got obstructive airway disease. We examine for surgical emphysema. They usually asthma and chronic bronchitis. They do get surgical emphysema, or traumatic patient you get surgical emphysema. Therefore, we finish the palpation. We finish the inspection and palpation. Now we come to the percussion. 3-part بالpercussion. We said that 5-part in inspection and 5-part in palpation and 3-part what in what? In percussion. Percussion of the
Upper.
clavicle.
Clavicle.
So now. Yes. Then equal percussion of the clavicle, middle third of the clavicle percussion. Then we compare the right and the left spaces. لا هذه تسويها نزلي جواز هسه رجعي ونزلي جواز تنبعنت هنا من المفصل. Okay, from this is the way. تنبعنك 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 because he has got hyperinflated what? Chest. Therefore, three types of percussion. Clavicle, we draw, compare the right and the left percussion. Then specific percussion. Specific percussion, percussion of the heart, percussion of the liver, percussion of what?
Spleen.
Of the apex of the lung, and percussion of the diaphragm. Percussion of the heart this way. This is the second. We go to the heart area. Hyperinflated. Hyperinflated. There are only 2 indications for percussion of the heart. Hyperinflated chronic obstructive airway disease نلقى تنبانك الهارت area. الهارت سايز هو هذا الفست مالتي مال البيشنت الفست الهاند هذا الهارت سايز normal. This is the base of the heart and this is the upper part of the heart. Okay? And this is what? The apex of the heart. This is the area of the apex of the heart. Percussion in hyperinflated chest, there is no dullness. The second indication for heart percussion of the chest, of the heart, is when there is pericardial effusion. There are 2 indications of percussion of the heart. Pericardial effusion and in the hyperinflated chest. Therefore, it's percussion of the clavicle. Compare the right and left. هسه بدينا بالspecific percussion. Percussion of the apex of the lung. This is way of the percussion. Okay, this is the apex of the lung above the clavicle. Still tympanic. If it is dull, it means there is either tissue there or fibrosis or abnormal tissue is there. The third specific percussion is percussion of the liver. We choose the anterior axillary line, not the midclavicular. Anterior axillary line this way. This is the area of the dullness of the liver. Because this patient got hyperinflated chest, therefore the liver is being pushed where? In the abdomen. This is the first percussion in this line, the second percussion in the mid axillary line, and the third percussion in this way. بتقعد عليه شوية. ارتاح شوية. Percussion of the back on the right side.
لازم المريض يوجه إلى تستقبله.
dullness there. Okay. هسه شلون نعرف هذا؟ نعرف بأنه هذا which part of the chest. حرد إيدك حط على راسك. حط على راسك. This is نزلها بقى علي يسويها ونزلها. نزلها بعد. نزلها بعد. نزلها. هاي tip of the scapula على 7th. السفنث هذا السفنث هذا ال8 هذا ال9 هذا خليها. Okay, because the percussion of the liver downward being pushed by hyperinflated chest. The fourth specific percussion هو percussion of the diaphragm. This is the way of percussion the diaphragm. When we reach dullness, we ask the patient to take in breath. خذ نفس عميق وقطعه and hold it. It become what? Tympanic.
Tympanic.
Therefore, the diaphragm move in this way. Okay. Palpation خلصنا. Percussion خلصنا. هسه نيجي على auscultation. Auscultation. Auscultation of the type of breathing first.
Vesicular normal.
وفيزيكولار vocal resonance السماعة by stethoscope and extra respiratory sound اللي هي wheeze وكريبيتيشن وبلورال راب إلى آخره. أوكي حط السماعة وفحصي.
خرخش الواحد من فرغت واليوم فرغت معها.
بردت صورها العسل. نعم نام علي نام علي.
أول شيء from anterior يعني الدموع.
Yes.
بعد
عسل. This area
أيوة.
اسمعيني و this area و this area 3. We use the diaphragm usually. The best auscultation of the chest is by the bell. The diaphragm is okay. Nobody will say why you use the diaphragm, because most of the doctor using the diaphragm. The diaphragm. Bell, because all the respiratory sound are low pitch. Therefore we use the bell. Remember, bell having L, therefore it is low pitch. While the diaphragm, it's got H, therefore it is a high pitch for high pitch sound. And most of the respiratory sound are low pitch. Therefore, the best to examine the chest, auscultate the chest with the bell. But if you use the diaphragm, it's okay, no problem.
دكتور أولا
Type of breathing first.
Vesicular.
We have 2 type of breathing. Actually, we have 3 type of breathing. Normal vesicular breathing, or bronchial breathing, or there is a vesicular with the prolongation of the expiratory phase in chronic obstructive airway disease. Vesicular breathing just like this. Inspiration and expiration is short and there is no gap right away. While bronchial breathing is this way. Look to me.
there is gap between inspiration and expiration.
Expiration equal to inspiration and there is a gap and there is harsh, it is harsh, and therefore with the crepitation usually.
دكتور والانسبريشن اكسبريشن اثنيناتهم اللودر يعني تصير عالية. انما
هذا ايش عند المريض this patient?
اولا الاكسبريشن مالته prolonged.
Yes, he got the prolonged expiration because he got obstructive airway disease.
ايوه انت
Well, it is vesicular breathing all over, except in this area you hear bronchial breathing near the trachea, near the major bronchi.
دكتور بالبليت كلش يعني واضح.
كلش واضح يكون بالبيل.
كلش.
And we use this elastic substance to make a complete touch isolation of the environment from the body from the environment, okay? And we use it also in cold weather, not let the patient get some cold from this area because it probably hurt the patient.
I hear crepitation. Doctor.
Yes,
And this
there is a crepitation in this patient, coarse crepitation.
due to mucus.
In coarse crepitation, you should ask the patient always to what? To cough.
Cough because mucus
Cough.
causes.
كف كف زين فحطوا السماعة put the stethoscope and you hear the crepitation. It is coarse crepitation
Or true.
and it is and inspiratory and expiratory and slightly diminished by coughing.
حجي ممكن القح.
قولوا له قح.
قح.
بعد
قح حجي.
يطلع لنا بلغة.
يلا هذا وعفو.
دكتور
طلع